Endoscopic retrograde cholangiopancreatography is an examination that combines duodenoscopy and fluoroscopy to identify and treat stones, tumor, or narrowing in the biliary and pancreatic ducts. ERCP is a procedure with potential problems. When your doctor recommends a ERCP examination, a consent will be taken by a consultant to ensure that you understand what is involved and the risks explained beforehand. You should not take any food or drink at least 6 hours before the examination. Your stomach is to be emptied before ERCP to ensure clear viewing of the upper gastrointestinal tract. Usually, you are required to be hospitalized. On the admission day, please produce your appointment card and admission letter at the admission counter. Before the procedure, you will be asked to change into a patient gown. Please leave all valuables at home. Please inform if you have any surgical or medical history, allergies, or if you are taking regular medication, such as for diabetes, blood pressure, or blood thinning. You will be required to remove any dentures or spectacles. A temporary IV cannula will be inserted into your forearm for sedation or analgesic and other medication. This cannula will be removed before you are discharged from the endoscopy center. You will be transferred from ward to imaging center. Your throat will be sprayed with a liquid anesthetic to produce numbness in your mouth and throat. This tastes slightly bitter and the effect will last about 30 to 45 minutes. You will be asked to bite on a plastic mouthpiece to prevent damage to the scope and allow the passage of the duodenoscope through your throat. An intravenous injection of sedative will be given by the doctor. The doctor will then insert the duodenoscope through your mouth, to the back of your throat, down the esophagus, through the stomach, and into the second portion of the small intestine, duodenum. For a clearer view of the inner lining of your upper digestive tract, air is pumped into your stomach. This air will cause the sensation of wind. In the duodenum, a small opening is identified called ampulla of Vater. A small plastic tube called cannula is passed through the endoscope into this opening to the bile duct and or pancreatic duct. Dye is injected and X-rays are taken to study the bile duct and or pancreatic duct. During ERCP, one of the common treatment is sphincterotomy. This involves making a small cut in the ampulla of Vater to enlarge the opening of the bile duct or pancreatic duct. This is done to improve drainage or helps to remove stone in the duct. If your ERCP includes a therapeutic procedure such as removal of stone, a basket will be passed through the endoscopy and into the small opening called ampulla of Vater to the duct to remove the stone. On completion of the examination, The doctor will suck the air out of your stomach as the duodenoscope is withdrawn. You will rest till fully recovered. Initially, you may feel slightly bloated from the air that was pumped into your stomach. This feeling will gradually subside. You will experience a numb sensation in the throat. Do not attempt to cough hard. Follow doctor's instruction for post-procedure oral intake. If the procedure has been trouble-free, your doctor may allow discharge the same day. You may feel drowsy for a period of time due to sedation. Therefore, you should not drive or operate machinery that requires judgment or skill. Drink alcohol for the rest of the day. You are advised not to take sedation medication unless prescribed by your doctor. Avoid signing legal documents and make major decisions until the next day. Please arrange to go home accompanied by a family member or a friend. Do consult your doctor if you experience severe pain or discomfort after the examination.